Hi, I'm Dr. John Harper from beautiful Oceanside, California. I'd like to thank you for taking a moment to get this very important information. Did you know that you can get rid of joint pain and you can do it all without the dangerous side effects of drug shots and surgery? With regenerative medicine, there's a whole new world. Your body can use its natural ability to heal itself by using something that your body already has. But unfortunately, your stem cells are not doing the job that they were supposed to do for whatever reason, and you can get new stem cells and you can get it taken care of. And you only need the one treatment. This is not an ongoing thing. This is not something that you're going to have to keep doing on and on and on. You get the shot and you're done, and you will recuperate. We're right now at 90% success rate with our patients and their pain. It's an amazing thing to have the patients come back in and after 3 months and we re-x-ray, and we're having 100% success. Every single one of them has grown cartilage back into the joint space, which facilitates the healing and it allows you to feel better. Just imagine that you could go back and do the fun things you want to do, like this lovely couple riding bikes, or maybe you're a walker, or maybe you want to go out and be in the ocean. Or maybe you want to go play tennis or golf, or maybe you're a ping pong person. I have a ping pong patient that wanted to get back to ping pong, and she's playing ping pong again. So just sit back and relax. I'm going to be very clear. I'm going to use some big words, but I'll fully explain them. And I just want to let you know that I'm coming up on 33 years in practice. We just had our 7,800th patient. And this is the most amazing thing I've ever seen. People that I never thought I could help, we're helping now. And again, it's just a simple injection and it's over and done with. So sit back and relax. Let's talk about how we do this. So first of all, I always want to start with a testimonial here. And here we have Mike, and just sit back and watch this.
Well, before coming to the office, I've used, it started out with pain in my right knee, and I started out with Synvisc. That was a deal that I had 3 shots in 3 weeks, and took the pain away. It took the pain away for about a year, and then every time I went back, it got less and less and less until the pain got really, really bad. And then I've had this other treatment called ablation that was going to kill the nerves in my knee, and it didn't. And then they put me in braces. I was in steel braces on both my knees then. The other knee went out, and I was in both knees were in braces when I showed up here 6 months ago. And I've had this problem for over 6 years now. And when I arrived here, I could barely walk, and it was my choice to come here and see what he could do, because nobody else could do anything for me. Now things are completely turned around. I'm walking. I threw the braces away. I don't have braces anymore. I'm walking. I'm pain-free. I'm opioid-free. I haven't had no opioids in 4 days for the first time in about 4 years.
Wow.
And so I'm doing really good. I'm sleeping all night long. There's no more constipation and all the side effects that go along with the opioids. It's a miracle to get off those things. So it's anybody that's on those things, I suggest you come here and try this, because the opioids, I just feel 100% better in the last 5 days since I get off those.
Wow.
And it's really helping my knees. I feel as though my knees are getting a lot better with the stem cell injections, and I think I'm on my way to this time to really play golf.
Yeah,
in the next 4 or 5 months,
Yeah,
I should be able to play golf.
I'm so excited because that's what you told me you wanted to do, is you wanted to play
Yeah.
golf. I said, well, let's see what we can do.
Saturday, I went to my niece's wedding, and I actually got out on the dance floor and danced for about 10 minutes out there, 15 minutes out there with my niece, and she couldn't believe it that I was up and dancing, because I've been sitting around everywhere I go for the last 4 years, and she couldn't believe it that I was up and dancing and having a good time. So
Yeah.
I really surprised a lot of people with my progress that I've made here in the last 6 months.
Awesome.
So I'm really happy about that.
Great.
I would tell them to don't hesitate to come here And you got to have patience. It isn't something that's going to happen overnight, but it will happen.
Isn't that amazing? Isn't that amazing? He went through all those things. And the one thing that I really pick up on when Mike's talking is that, isn't it amazing that he can go back and do the things he wants to do? He's going to go golf now. Isn't that great? He danced at his niece's wedding. He wasn't the guy that was looking for a place to sit down as soon as he walked in. He shocked everybody that he had gotten better and healthy. Amazing. So, this here is one of my grandchildren. This is Noah, and this is my daughter, and again, a couple of my grandkids. And why do I show that to you? Well, I'm just really proud of them, and I just like throwing this in here. Actually, this is my why. I had a problem with my shoulder. In high school and college, I was a nationally ranked shot putter and discus thrower and track. And that had kind of taken its toll on my right shoulder. And then here, about a year and a half ago, I was out surfing, and when I went to go dive into the water as I was falling off my board, there was no sand. There was sand and no water, and I jammed the shoulder real hard. And after that, I couldn't raise my arm any higher than this. And that took away a lot of enjoyment. I swing dance with my wife, lift weights, brushing your hair, brush my teeth, comb my hair, all these things I couldn't do anymore because of what had happened. And so a friend of mine invited me out to his office who was doing the recuperative medicine. And he recommended a stem cell shot for me, and I got it. And 2 months later, I think I was brushing my hair, lifting weights again, feeling great. And I thought, well, okay, great, we could go out and go dancing. But in the meantime, my wife, her knee had gotten really bad. Prior to meeting her, she had been in 2 really bad car accidents and crushed her knee up against the dashboard. Both times she was told that she needed surgery, but she didn't want surgery. She knew that there's a lot of dangers with having surgery. So she just suffered along. Well, we got the stem cells, and she got the injection. And guess what? Now we're back to dancing. Now we're having a great time. We like going to places like SeaWorld and Knott's Berry Farm and walking around. And her knee had gotten so bad that we couldn't do that. So after having stem cells myself and my wife, I knew this was something I had to have in my practice. And so we integrated our practice. We have a medical doctor on staff. We have a couple nurse practitioners on staff. And then we have myself. And so by having this group integrating medical, chiropractic, and nurse practitioners, we get the best results because we have the best of all worlds. And I just want to let you know that this is why I do these things. I got all these grandkids, and I'm a big guy, I'm 6'4", and they climb around on me like I'm a jungle gym. And I love it because my arms and my shoulder strong. I can support them. I don't worry about playing with them, throwing them in the air and catching them. It's a real joy for me, and I would love for you to have that same kind of joy. So I'm going to go through some things very quickly here. It's kind of the downer part of what I explained because I want to get to the good stuff. So arthritis. 1 in 2 people by the time you're 65 years old going to have arthritis. So what are the normal choices? So usually drugs. And right now, on average, 18 medications for adults over 60. That's crazy. NSAIDs, non-steroidal anti-inflammatory drugs, over the counter, usually Aleve, Advils. This is where a lot of people go. They think, oh, not a big deal, but you get stomach ulcers and bleeding, high blood pressure, fluid retention, kidney problems, heart problems. And when you go and you talk to your physician about this, it could be the side effect of the medication, these drugs that you're taking, but instead of saying, hey, are you taking Advil and all that, maybe this is causing these problems, you just get another pill. So this is how you quickly end up with those 18 pills on average for any problem that you come along. There, a pill for any ill. So the disturbing trend in pain management, opioid addiction. Opioids, the company knew that they were highly addicted. They hid all that, and now they threw all this out there. In 2017, there was a Department of Justice found 400 people involved with a scam on the medications. $1.3 billion that they had stolen. And Department of Justice Jeff Sessions said too many trusted medical professions like doctors, nurses, and pharmacists have chosen to violate their oaths and put greed ahead of their patients. Not only did they make addictions worse for people who were already addicted, they went ahead and created addictions. Can you imagine that? That you're going to make money by ruining somebody's life, all right? Yeah, I don't know about your beliefs, but I kind of hope there's a place in hell that's just a couple degrees hotter for these people. This is disgusting that people get put over, that are money's more important than people in their lives. It just makes me sick. So let's move on. So the United States consumes 75% of the medications produced in the world. So guess what? We're only 5% of the population. So to put that into perspective, let's say that you have some kind of family reunion, some kind of get together, and you're putting it on and you buy all the food and all the drink, and you get 100 people there, and 5 of them eat and drink 75% of what you provided. You'd be a little upset, right? That means 95% are going to have to deal with what's left over in 25. So it just seems out of whack. Our country is not very healthy. We have a lot of sickness, a lot of illness, and yet we take all these drugs. Doesn't seem to be working right. Now, another option is cortisone injections, and I know if you're watching this, there's a good chance that you've done this. And the thing about cortisone is that it works most of the time. You get the injection, wow, feels better. How does it work? Well, it's an anti-inflammatory. It knocks down inflammation. Inflammation is one of the main reasons that you feel pain and discomfort. But the problem with cortisone is, guess what? It makes your arthritis worse. It actually accelerates joint destruction. Now, I know when you go in to get the shot, you're in pain and the pain goes away. That's great. And maybe you don't care about that. But goodness gracious, you got to start trying to figure out a way to fix this problem rather than just keep covering up the symptoms. Also, you get osteoporosis, thinning of the bones, bruising, weight gain, high blood pressure, cataract formation, and thinning of the skin. A lot of side effects with the cortisone shots. And it eats away at your joint. Right here, this is the top of the femur. This is the top bone of the bottom part of the thigh bone. And this should be all bone. And this person had 3 cortisone injections in a year, and it ate away at the bone. This person had to have knee surgery. This is why you get to see this picture. It's because they were on their way to do the knee surgery because of this problem. A huge problem that could cause infection and get into your bone marrow and then into your bloodstream, causing septicemia that could cause death. So then there's surgery. Now, every time I look at this, it's like, gosh, this must be fake. This must be, a plastic model because it just looks so unreal. But this is actually what they do, is the surgery. Now, sometimes people think that surgery is the only way to go. And there is patients that come to my office. Now, I don't recommend the surgery. Maybe my physician or my nurse practitioner might, but I don't recommend the surgeries. I just tell them we can't help them. The problem's too far gone. And sometimes we have that. And sometimes you have to have surgery. And I'm sure some of you sitting here watching this have had to have surgery. And maybe it worked for you. And that's just great. And I'm glad to hear that. But only about 1 out of 3 are successful. That's the statistics that they have on knee surgeries. It's pretty much about 50% for most surgeries. It's a 50-50 crapshoot. And, surgery has its own problems as well. Infections. 90% of everybody that comes out of a hospital comes out with an infection called MRSA. And you got to take antibiotics. It takes a long time. And I have patients that come to me that had the knee surgery and had MRSA so bad it created all this scar tissue that the knee surgery never had a chance to work. And now they're coming to me to work on all that scar tissue. You can get blood clots. The downtime. I had a patient the other day. She says, I don't think this is really for me. I think I'm just going to go ahead and get the surgery. And I said, why is that? And she says, well, the surgeon told me in 2 weeks I'd be up playing golf. And I kind of like, wow, this doctor must really know something brand new and fancy, because most people are still walking around on possibly some crutches or a walker for, depending on the knee surgery, for a while. then there's the downtime and the cost. Now I keep talking about knee surgery because that's the biggest one that I see quite a lot. But it's the same thing with back, neck, shoulder, elbow, hand, your feet, your hips. It's the same thing. The joint is wearing out and you gotta fix the underlying problem. You can't just replace it with some new hardware. And also, these surgeries only last maybe 10 years. You can only get one or two of them over the years. So Alex Smith, quarterback for Washington, last year got injured, broke his leg by his knee, and he went to have surgery, and he got this infection, and now they're not even sure he's going to be able to play again. It's terrible. The problems with getting surgery these days. So this was an article, this is actually from Kaiser's Health newsletter, and it said researchers said that some patients are offered surgery that they don't need, and that money can be a factor. So the doctor earns a lot more if they do surgery. The average surgery for knees, $75,000, back, $80,000, a hip, $65,000, a shoulder is $55,000, and the surgeon gets a good chunk of that. So it's unfair. And then in this article right here, it says up to a third of knee replacements pack pain and regret. People, once they've had their surgery, they're not happy, they're worse. This lady right here, she was promised that in a couple weeks she'd be up and around and having a great time. And she's not. She's miserable, and she's trying to find a resolution to her problem. Do you want to know what the surgeon recommended? Another surgery. So, doing the same thing over and over and over, then expecting different results, that is the definition of what? Insanity. This was a quote by Albert Einstein, pretty bright guy. So now that we've run through all that, I want to get to the things that I want to tell you about that's exciting and new, that's going to really help you out. So we do something completely different. In my office, we use the latest researched and proven treatment methods to work with the body's own ability to heal itself. By doing that, you are in concert with what your body normally does, rather than like drug shots and surgery that go against it. All right? By helping the body do what it does naturally, we accelerate the innate healing process. Your body knows how to fix itself. You break your bones, it's not the cast and the pain medication that you take that makes you better. It is your body's own ability that knits those bones back together. So when you use recuperative medicine, you feel better faster. And what we do is called regenerative medicine and recuperative therapy. So regenerate. What does that mean? To build, to grow, repair, or create new tissue. And this is what we do naturally. We regenerate our skin every 3 weeks. Did you know that? You get all brand new skin. Now you're going to look at your skin and you're going, well, Dr. Harper, my skin doesn't have that new car smell. It doesn't look like it's 3 weeks old. Well, we're going to talk about why those things are happening as we go through here. Every 6 weeks, you get all brand new intestines. Every 3 to 6 months, you get brand new muscles, right? But why does this stuff keep hurting? Again, we'll come back to that a little bit later. See, regeneration and healing is encoded in the DNA. Our body is constantly replacing itself, and you have to have the stem cells to allow the body to work the way that it's supposed to. And it's in your DNA to get better. And when you're not getting better, there's something going wrong with that recuperative system. And that's what I work with to get you better. So what are stem cells? Well, stem cells are natural. When you are born, 1 out of every 10,000 cells in your body is a stem cell. And what the stem cells do is they go around and they heal you. Your stem cells have GPS for inflammation. And inflammation happens with every single time that you have an injury or some kind of health issue in your problem. So the stem cells go running over to where the injury is or where the damage is, and it does a bunch of different things. First of all, it'll reproduce new cells. So right here could be muscle, bone, fat, cartilage. It goes over there to where the damage is, where the inflammation is, and then it starts to replicate and replace the damaged tissue. Amazing. Stem cells also replace themselves. They are constantly, when things are right, they are constantly creating new stem cells. Also, apoptosis. It fights apoptosis. What's apoptosis? Cell death. Now, our cells have normal cell death, and then they have early cell death. And if your cells are dying faster than they're supposed to, the stem cells get in there and slow down that process. And then it fights inflammation. Isn't that great? Your body's so smart that it creates something that's in your body normal and naturally that is anti-inflammatory, that goes to the area where the inflammation is and naturally gets rid of it by healing the area and getting rid of the inflammation. And therefore, you feel better and get to go back doing the things you want to do. I've been doing this, like I said, for almost 33 years. And the body's amazing. It is an amazing piece of machinery run by the computer that's your brain. But it has to have the things it needs to do the job it was built to do. And that's what we do, is we create that environment for you to get better. So why all the attention in stem cells? Well, in 2016, I think, yep, 2016, National Institute of Health put $1.5 billion into stem cell research. National Institute of Health only has one job: to see where America, the government, should invest its money to help people and the Americans to be happier and healthier. That's it. All right? So we do that. Elon Musk, all right, the guy with Tesla, he has done investments into stem cell research. Thiel, his partner that created PayPal, that he's invested. State of California's invested. Pretty amazing. So there's lots of going on out there that people are putting their money into the stem cells to get good research. So I want to share with you, the doctor's office that I went to was in Little Rock, Arkansas. Little did I know that's the center of stem cell treatment. And so my wife and I go there, and he is telling me that the governor had just signed legislation that mandated that when somebody became injured and needed surgery was recommended, if they were an employee of the state or their insurance was provided by the state, that it was mandated that they had to have stem cell therapy first. And in doing it, they've already saved over $100 million. $100 million, that's a lot of bucks to save in just one state, Arkansas. And I'm in California. And Arkansas, the population would fit, probably from Oceanside south, quite comfortably. And yet here, California doesn't even think of that kind of stuff. But just the first year, $100 million. They had people get back to work faster, and definitely had way less side effects, zero side effects essentially for this kind of treatment. Amazing stuff. So this is really important. This is going to help you to understand why I use a certain type of stem cell versus another kind. When you're born, like I said, 1 out of 10,000 stem cells, 1 out of 10,000 of your cells is a stem cell. So a lot of it, when I first started having children, and I'd watch them learn how to walk and bam, fall down and hit themselves and crash and cry. And I got nervous about that, but my mom says, don't worry, kids are made of rubber. And you did the same thing, and your brother did the same thing, and that's just what everybody does. And as I kind of watch my kids grow up, when you're young, you're kind of made of rubber. You recover real fast. Well, why? Because a big part of you is stem cells. You got a lot of these guys that are young, stem cells that are out running around, doing their thing, healing up the body, and you get back on track quite quickly. And as we get older, as a teenager, only 1 out of 100,000 is a stem cell. At age 30, 1 out of 250,000. So only 1 out of 250,000 is that. So 1 out of 400,000 at 50, and at age 80, only 1 out of 2 million. So you're starting to see the picture of why we get older and why we don't heal as well, because we don't have the numbers of stem cells that we need. You have to have a certain amount. If you only have, say you're 50 and only 1 out of 400,000 of your cells are stem cells, then you're very limited on where they can go and what they can work on. So it's a big, big difference. Also, when we talk about the new stem cells, they're going to replicate a lot more. So when you get to be 80, your stem cells that you do have, they only replicate 40 times. When you're 50, your stem cells, they only replicate about 100 times. Do you know that when you're born, those brand new stem cells, they replicate 2 million times. 2 million times. So do you want 4? Do you want 100? Or do you want 200 million replications of cells? Well, I want the new cells. That's what I want. So there's 4 different types of stem cell therapy. There's the fetal embryological. This comes from aborted fetuses. So right there, I'm out. It's illegal in the United States, lots of moral issues, and I'm not interested. Also, it has DNA and protein that your body will pick up as not being you, and you're going to get an immune system response to that. Just like when somebody gets a liver replaced, they have to take medication to keep their immune system from killing that liver that was donated to them. This is the same thing. You have to make sure that we're not putting some substance that's somebody else in you, so you have an immune system response. And there's amniotic or placental. There's a lot amount of cellular debris. The amniotic fluid and placenta is floating around inside a mom, right? It's kind of like a little jacuzzi there. And as the baby is growing and developing, it throws off its cells. Like we said, skin cells every 3 weeks. So as the baby's going through the process of being developed in that 9 months, it's throwing off dead cells into the amniotic fluid. Well, those cells are related to the baby. So you can end up with an allergic reaction from the amniotic fluid and have an allergic response. And the stem cell count, very difficult to figure out if it's this month or this month. It varies a lot. So autologous adult stem cells. So this is the one you probably heard the most about, where it's taken out of your body. It's taken out of your fat or your bone marrow. So let's talk about that. So one of the patients one time said, I think I'm going to go do this where they take it out of your fat because I could use some liposuction. And I said, well, wait a second here. This is not plastic surgery where they try to make it all beautiful and smooth and everything like that. They just kind of go in there with a vacuum and suck it out of you. Also, if you're going to have it out of your bone marrow, typically they put a big giant needle and they stick it in your bottom and they poke through and break through the bone in your pelvis and they suck it out of there. So it requires invasive surgery. Well, there's a problem with that, isn't there? When you have invasive surgery and you damage the tissue doing the surgery, what are you going to get? You're going to get inflammation. And when you get the stem cell shot, what's the stem cells going to do? Oh, look, there's some inflammation up there. I better run up there and I better take care of that. So out of the joint or wherever you get the stem cell shot, they're going to start leaving and go take care of that surgery. Not potent enough to be super effective. Like we said, you only have so many. At 50, 1 out of 400,000. At 80, 1 out of 2 million. Not a lot. Also, they're not going to replicate nearly as the brand new ones. It's expensive because you're going to have you're going to have a surgery and the injections. And, it's dependent upon your age and health. So some people can do it, but they're very young. And I don't see a lot of people in their 30s with joint destruction and these kind of problems. So human umbilical cord tissue, this is what I use. This comes from a healthy born baby and a healthy mother. There's no potential for adverse allergic reaction. We use what's called the Wharton's jelly. I'm going to show that in a second and explain why there's no allergic reaction. They're completely undifferentiated cells. They can turn into anything that we need them to turn into to get you healthy. Simple, fast application through an intra-articular injection. Just get a shot that's very comfortable. We spray you with some cold spray to numb out the skin. We put betadine on you. Most offices uses rubbing alcohol. We use surgical betadine because it's very, very good to make sure that we're not going to get any infections. Get the shot over and done with. Very simple. And it's customized for each patient. So like I said, we use the Wharton's jelly. This is the umbilical cord. So think of this as the umbilical cord, all right? It goes from the mom, connects to the belly button of the baby. So if I was to take the umbilical cord and cut it like this, take this piece away and look at it like this, like right down the barrel, this is what it would look like. And see, it's got the two arteries and it's got the umbilical vein. So we used to use the blood, but as we started doing that, we realized that there could be the chance that you're going to end up with some cells from the mom, or the blood from the mom, and there's going to be some white blood cells in there that could actually get you a little minor reaction. So we stopped doing that and we went to the Wharton's jelly. That's this cotton candy looking stuff. What the Wharton's jelly does is it supports and holds the arteries and the vein in place. So when we use the Wharton's jelly, you're going to get 3 to 5 million stem cells with each injection. That's a huge amount. The Wharton's jelly is tons and tons of stem cells, and it has a few other things in it. So, a little hard to read. I'll get over here. So, it comes with these what are called factors in it. One of them is anti-inflammatory. Well, right off the bat, you get your injection and the stem cells is going to start working on that inflammation and start making it feel better. It has wound healing factors in it. What does that do? It goes in and actually causes this damage to get healed. It has homeostatic cytokines. What's that? Cytokines is the stuff that one of the things that comes out with inflammation. And when you start getting arthritis, degeneration going on in a joint, the immune system tends to overreact. And this is why it causes so much pain and swelling and discomfort. So these homeostatic cytokines goes over to the immune system and goes, calm down, we got this. We can take care of this for you. And then it has growth factors. We want to regrow that cartilage. We want to get that cartilage in the joint to get better. And that could be the discs in your neck and your back. It could be the cartilage in your shoulder, your elbow, your hands, your wrist, your hips, your knees, your feet. Anywhere that there's a joint, the stem cell with Wharton's jelly can do its job. Now, quality assurance, I want to make sure that this is very clear. The stem cells we get is from a company called Invitrix. I'll talk about them in a minute. And Invitrix follows every single FDA cleared protocol to use the stem cells. Also, really, Wharton's jelly is the only stem cell that's really been authorized by FDA to be put into the joint. When they pull that out of your fat and your bone or your bone marrow, that's really only supposed to be for blood diseases and not joints, but they do it anyway. So with the quality assurance here, and I'm just going to read this, the behavioral assessment of the mom that's going to donate the umbilical cord. It's physical assessment. They do donor medical history and communicable and disease testing. So the mother goes through a process. They just don't take every umbilical cord. They check to see, does the mom have risky behavior? They get tested to see, are they doing drugs? They have their medical records looked at. They do a full panel to see if there's any disease that's in her blood that could be passed on through that. Now, it would be rare that any of those things would make their way into the Wharton jelly, but myself and this company does not play chances with your health, and so they go through all this testing to make sure. Also, one thing that's important, this company does not pay the mother for the umbilical cord. They have representatives in doctors' offices that just say, hey, would you like to donate your umbilical cord? And if you do, just sign this paper. And the umbilical cords come from live, healthy births of planned C-sections. They have to have all of that, and the mom has to pass all of this. And then the cord all gets tested as well through all this stuff, and make sure that this is a safe choice for you and I to do. Other companies will pay for the umbilical cord. And I don't want a company that does that, because then maybe there's not going to be some honesty when it comes time for, history of your health and the problems and so forth. Someone's going to want that money more than they want to protect you from having problems. So the advantages of human umbilical cord tissue is that immune system. So anybody can be treated. You're not going to be affected by it. It's anti-inflammatory, modulates your immune system. Optimum ability to stimulate regeneration. This is the top of the line. These babies, when I purchased these, They're the most expensive, but it works, and it just is amazing, the results. It's amazing, amazing. So imagine for a moment that you can go up and down the stairs easier. You can get in and out of your car without pain. You could walk with confidence again, feel steady again, be out there acting like, you're the talk of the walk there, right? Okay, enjoying your family, like I said, taking trips, enjoying family outings again, like Mike was. So I'm kind of a nerdy person, really into science. I love that. And so I read and researched this stuff like crazy. So if you go to clinicaltrials.org, there's over 5,300 active studies on stem cells right now. If you Google stem cell research and therapy, you're going to get 6,336 pages with 20 different research projects on it there. I can't even imagine how much stuff is there. PubMed. This is where researchers and physicians and PhDs go, and so it's a little rough to get through because it's very, very nerdy, but great research and information there if that's for you. So I'm going to read this here to you. This is Mayo Clinic. Ever hear of those guys? Mayo Clinic? Yeah, me too. #1 hospital and facility in the world. So at Mayo Clinic, an integrated team, including stem cell biologists, engineers, doctors, scientists, work together and study regenerative medicine. The goal of the team is to treat diseases using novel therapies, such as stem cell therapy and bioengineering. This is the same thing I'm doing in my office. This is what I put together to help people. And, Mayo Clinic, great place, a lot of good stuff. But, they're still just doing the research and the training. They're not really providing this treatment for yet. Now, one thing is real important is that, again, in the search, when I put in stem cell therapy research, up came Mayo Clinic finds surprising results on first ever test, and it was stem cells. This came out December 6, 2016. Now, when I get done talking about this, you're going to wonder, how come you never heard about it? And I'll share about that. So what they did with this test is they took all these people, all these patients, and they had to qualify. They had to have a certain amount of pain in both knees, and they had to have a certain amount of problems on the exam, and they had to have a certain amount of damage that was visible on the x-rays. And so they gave one knee a shot of stem cells, and the other was a placebo, right? Some saline. Now, the person doing the injections didn't know which was which, and the patient didn't know which was which. This is the classic double-blind gold standard for research. Months later, they brought them all back in, took the x-rays again, and they filled out all the paper to see how they were doing with their disability, and did the exam again. Guess what? 95% of them all got better. 95% of them had decrease in disability. 95% of them went back to doing fun things that they hadn't done before. Now, the funny thing is that both their knees got better. So that's kind of strange, isn't it? Now, in the study, they were saying, well, possibly this was placebo effect. But really what it turned out to be is that, and you can maybe figure this out by now that you've been educated on stem cells, that it felt the inflammation on the other side, and some of the stem cells that went into the one knee traveled over to the other side to work there. Amazing, isn't it? Just amazing. Now, some people, they need one shot. Some people need two shots but you only need one per joint. That's it, and then you're done. You're not coming back. You're not having regenerative therapy over and over. This isn't like your blood pressure, like your cholesterol medication, where you're just stuck with the doctor forever, and you got to get those pills. You got to go to the doctor. And you got to get those pills, and on and on and on. No, this is a one and done deal. It's really great. So FDA, now for a long time, FDA was real poo-poo on stem cells. They didn't want it. Why? Well, because they're kind of beholden to the pharmaceutical companies, and they don't want this out there. Can you imagine if everybody got stem cells and what would happen, to all those medications and all those drugs they make for surgeries and all those medical appliances and all the doctors and the hospitals and all that? What would happen if everybody could just get stem cells and get corrected? But Now he's on his way out, just moved on out here, but Scott Gottlieb, he decided that this was really good. He looked at the research. He said, you know what? This is something that we got to move forward on. So instead of the FDA being a pain in the rear end about all this, they've become a real proponent of it. And let's hope that the next guy that comes in as Surgeon General has the same attitude, because it's very safe. It works really well. You use a reputable doctor and a reputable company that does these things, you're good. You're going to have a great time. So this is my company, Invitrix. This is their corporate offices in Irvine, and this is their laboratory in Lake Forest. This is up in mid Orange County or South Orange County, and great company. Work really well. Any issues, any problems, they're going to let us know. And in the time that we've been with them, not a problem. Everything's great. So here's the FDA. The FDA got a hold of Invitrix, and Invitrix is part of a study with them. So when you come to my office with you and we send your information, now obviously not your personal information, but in a general, your age and the problem that you had and what we did and what kind of stem cells and, how did we do this and all that and how did it work? So we're part of a stem cell research project. This is amazing. I'm so excited that we are able to help our office to promote something so great. And you could be part of that too. So you don't have to be a sports superstar to get stem cells, but you just might feel like one. Here we have Peyton Manning. Guy broke his neck and he went and had surgery, and they couldn't clear him to go back and play football. He snuck over to Europe back when there was no stem cells here available and got the stem cells and played 2 more years. Got a couple Super Bowl trophies out of that. Kobe Bryant, 2 years before he was going to retire, he was going to stop because he was getting old, all beat up and playing in the NBA for all those years. And he went and got stem cells and was able to play. Tiger Woods. I was actually one of the doctors that was there at Torrey Pines when he on a Sunday we were brought in to do care for the golfers, but most of the golfers all had their own chiropractors, so I worked on a bunch of caddies. But Tiger, I was there and I went and saw him in the day where he had all that knee pain and back pain a few years ago, and was going to quit, but he made it through, and he made a miraculous recovery and made up something like 3 or 4 shots in the last 5 holes to make a playoff on the next day, Monday. Well, he stopped after that, and he didn't compete for a while because he was in such bad shape. But he went and got stem cells, and then here in this last year, he won a tournament again. Amazing. So, like I said, you just get to live life again. So, knee replacement. Studies show that if you have one knee replacement, 90% chance you're going to have another one. Why is that? Well, if you're leaning on your right knee all the time and because your left knee is hurting, what are you going to do to that right knee? You're going to wear it out and cause damage. It was never built to do that. So, again, if you've already got a knee replacement, great. I sure hope it worked out well for you. I hope you're one of the ones that are happy with what you did. But let's make sure we get that other one and maybe try and avoid doing that again. So I got a lot of pictures here, and it's pretty neat here. So the right knee before was 1.6 cartilage. Here's your femur bone coming down, your thigh bone. Here's your leg bone, and this is the space in between that has the cartilage. These are all standing x-rays. So it went from 1.6 to 2.7. You could just see the difference. See how much bigger that space is. You go right here, the left knee went 3.22 to 4.7. Amazing, great results. And person much better. Here you can see he went from almost bone on bone to 1.03 millimeter, and here the outside went from 2.3 to 5.6. Amazing growth. No measures, but you can just see. Look at the space right here, and look at the space right there. All right, amazing. If you look right here, went from 2.8 to 5.2, 1.1 to 3.8. Great results, very wonderful. All right, 7.52, 9.41. So, and I know I talk a lot about the knees because that's a lot what we see, but we do an awful lot of hips as well. So I'm going to use this picture as the normal. Here's your pelvis, and here's the up part of your femur, the upside, and it's a ball and socket. So you can see, here's the socket of the pelvis, and here's the ball of your femur going up in there. And you can see that there's space right here is the cartilage. This was so bad, look at this, the cartilage was so bad and gone that it was up against the bone in the upper part. This is horrible. This is a person that could barely walk. And now, back to normal. So backs too. This is an x-ray of the spine from the side. Here's the belly, here's the tailbone. Here would be the mid-back. This would be about the belt level. It's normal to have a curve going forward in your spine. When you look here, this is straight up and down. On x-rays, this is an indication of a disc, herniated disc, or some people might say a slip disc. Doesn't really slip, it squeezes out. 3 treatments on this patient, and this person ended up with getting that curve back and fixing that MRI, fixing that the bulge. So here's an MRI. So again, we're looking at the spine from the side, the front, the tailbone, the mid-back, and you look right here, this is the spinal cord right here. And in the spinal cord, here are the discs in between the bones. And you notice that all these discs are right up against the edge where the bone is and not going into the spinal cord. But look at this one. Look at that darkness right there. Look at that gigantic herniation bulging into the spine. This would be a surgery, no doubt would have been a surgery had a surgeon got a hold of this person. But look after, look where it is. It's barely touching into the spinal cord. And this is after stem cells. So everybody's got questions, right? I can see you raising your hands right now. So let's answer some of those questions. How long does the treatment take? Well, this is pretty amazing. It's a 2-day process. Now, it could be a little bit more if you'd like, all right? But I'll come to that in a minute. So I do a consultation and an exam and x-rays with you, and we don't charge for that. There's no charge at all. We'll review your results and your x-rays together to make sure that you're a great candidate for the HUCT therapy that we do in our office. And that whole process takes about an hour. I have a digital low radiation x-ray machine, and we'll take your x-rays in about 4 to 5 minutes. I'll be sitting down looking at it with you, and we'll do the measurements on your x-rays just like you saw in these pictures. And then you come back, and if you are a good candidate, I'm going to sit down with you. I'm going to go over the fee, either myself or my office manager, and we're going to go over the fees and how that works. We have payment options, monthly payments, all that. And then you come back another day, and you have pre-injection therapies. I'll explain that in a minute. And then you have your injection. It takes about an hour. So the stem cells will be doing their job for a year, but you only need the one treatment. That's it. And this is kind of what it looks like when you come to my office. I'm going to sit down and talk with you, take some notes, learn a little more about you and your problem. We're going to take some x-rays. This is actually my wife acting like a patient and getting the x-rays of her knees. Here we are sitting there going over the results. We have a TV on the wall, much easier to look at. And we go over that and show you what's going on with the joints. So I mentioned about pre-injection therapies. So I was at a conference, and this one doctor was talking about how he was concerned about the state of the joint when you do the injection. So when you have arthritis, when you have wear and tear and degeneration and inflammation, it's very dry. It's dry in there. A lot of bad, nasty stuff is in there. It's just not a good place for the stem cells. And this got me thinking. So, I've been in practice, like I said, for nearly 33 years, and we have all kinds of things we do in my office. And so I said, well, wait a minute. If there was something I could do to prepare that joint, to make it a little bit more homey for the stem cells, that would probably make us have better, quicker, faster results. I thought about it, and I came up with an idea. So what we do is we have a therapy in my office called non-surgical decompression. where we just elongate the joint very gently, very gently. So for instance, in the knee, you can see this person's lying down on their back, and here's their leg straight here with this, and this is a computer, and then there's a brace around the ankle, and then a cable that's connected to the computer. And we put some information in the computer about you, and then it very gently pulls on the knee, and it actually opens up that joint a little bit. Well, what does that do? It creates negative pressure in the joint, and fluid and oxygen and nutrition gets pulled into the joint, because we're kind of juicy on the inside, just not where there's damaged joints. Then we also use what are called pulsed lasers. Now, I know most people think of lasers and they think, oh, well, that's going to burn me, that's going to cut me. Well, we don't use that. We use what are called cold lasers. They pulse very strong. And when they pulse in there, they do three things. They knock down inflammation, they increase circulation, and knocks down, and it promotes cartilage growth, right? So we're already getting the knee ready for what we want it to do before you even get your stem cell injection. Now, I've shared this with a lot of my friends that are out there in the world doing the stem cells, and they're very excited about it because they're getting better results. But you know, if they're not doing some kind of pre-injection therapy on you, you're not getting set up as well as you need to get your stem cells and get those great results that you're looking for. So we use another thing also that's called PEMF, pulsed electromagnetic fields. And so what PEMF is that it puts off a frequency that stimulates the cartilage to grow. There's been studies that show that when you do the stem cells and the PEMF, you get an even better results. So this is our PEMF generator that we have in the office. Very interesting looking kind of a contraption. And what it does is just like if somebody is tuning a piano, and they'll tighten or loosen up the string to tune it right. And then they'll tap that string, and when it's got the right sound to it, the right frequency, the person doing the tuning will have a tuning fork, and the tuning fork will start to move. So, and then you could hit the tuning fork and then the string will start to move. Why? Because it's got the same frequency. So that vibration that moves across the air starts to get that string and get the tuning fork doing the same thing. So this is very powerful. We take a light bulb and we hold it about 2 feet from the machine, and the light bulb lights up. That's how strong it is. Very, very safe, very effective. Many sports teams use this. Lakers, the Dallas Cowboys. Dallas Cowboys even have a protocol that's named after them, the Dallas Cowboys protocol for cartilage. That's one of the ones we use most of the time. It's great. And the cool thing is you just sit there. Right? You just sit there. We have 4 or 5 chairs, and you just sit there for 15 minutes and you're done. It's great. Tony Robbins, you know, the motivational speaker guy, he's got 3 of these, 1 in each of his homes, and he's asked the company to create 2 more portable units so he can have them in one in his helicopter and 1 in his airplane. You know, all the life. Isn't that great? So, are there any side effects? Well, you know, a little injection discomfort, no more than like a little bee sting. For a day or 2, we're going to ask you to kind of take it easy. I don't want you laying around all day, but I'm going to ask you to, you know, I don't want you bungee cord jumping. I don't want you doing any hard exercises. We're just going to let it go for a little bit. And then we're going to see what we could do about limiting your anti-inflammatory drugs 2 days prior, or a day prior, sorry, and for 1 to 2 months after. Why? Because if you're taking anti-inflammatory medication, it's going to cover up the inflammation that the stem cells are looking for. And we want to be able to do as well as you can. Now, some of you are thinking, oh my God, I can't stop taking this drug. Well, first of all, if it's a prescription drug, we're not messing with it. The other thing is, if it's over the counter, we have quite a list of more alternatives that you can take. We haven't run into a problem yet. Downsides. Well, you know, everybody wants to know, when am I going to feel better? I have people that feel better within a week. I have people that feel better in 6 weeks. I have people that are more like 3 months. Everybody is different. Some have slower results, some are better. But I'm going to tell you, there's some things that I'm going to recommend for you to do that will completely accelerate your loss of pain and get back to doing the things you want to do. The patients that follow my recommendations, they get the better result. So remember, 28, 65, and 90. So every 28 hours, the stem cell's replicating. So it'll replicate 65 times in 90 days. So that 3 to 5 million has now, I don't know, I can't even comprehend that numbers, in the billions, I guess. So by using these newer stem cells from the Wharton's jelly, you're going to get the best results and minimize your downside. So like I said, 4 to 6 weeks are pretty typical when people start feeling better. So let's talk about Medicare. Anybody hear about Medicare? Yeah. So let me read this to you. This is from the guidelines of Medicare. A treatment plan that seeks to prevent disease, promote health, prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic disease condition is deemed not medically necessary. Now, wait a minute. I would think all those things would be medically necessary, right? If they really cared about you and wanted you well, wouldn't they pay for things that would help you get fixed and squared away? But they don't. They don't. Why? I don't know. I hate to think that the pharmaceutical company now is even running Medicare. I don't know, but man, they sure got a lot of money, and they sure put a lot of money into lobbying politicians. Number one lobbyist in the world by far is the pharmaceutical companies. So I don't know, but I just have to tell you, I'm really sorry. Stem cells are not covered. It's not a covered insurance procedure. Sorry. Now, before you turn this off, I have an alternative, and I'll talk to you about that in a minute, but I'm upfront about everything I do in my office, including the cost. So let's talk about that. Average stem cell cost. Well, in American clinics, a lot of them are doing $10,000 a treatment. Some have gotten down to $7,000 a shot. And then they say, well, I'll go out of the country and get it cheaper. Well, sometimes what happens is those are even more expensive, $20,000 to even more, $100,000 in other countries. So we use the Wharton's jelly human umbilical cord therapy tissue, and the first injection is $4,250. Now, if you have a second injection, it's $2,000 on the same visit, right? The reason being is that because I get a discount from Invitrix to help promote the product to see and give them more information on this research project, so we can get it all going with the FDA. So we also have coupons that if you get back to us in a certain amount of time, save you $300. So if you get one injection, that would be $39.50. If you get two injections, it's $59.50. Now people are going to go, well, how do I know if I needed one or two or whatever? I'll go over that with you. I'll be very clear with you. Sometimes I recommend two and people say, no, I just want to do one. That's fine. That's your call. We'll go along with that. So we also have interest-free payments. I think it's 18 to 24 months you can do that, right? So again, I know this is money, but I'm going to tell you, if you just have a regular insurance, an 80-20 insurance, and you get a $50,000 surgery, right? That still means that you're going to pay $10,000 of that. And you have to go through all this stuff and all the risks. So, that's how we do that. So also this fee includes $700 bonus. Now I said you come in and get one shot, an evaluation, and then you get a shot, the injections, and then that's that. Well, but you're going to give you the pre-injection therapies on the day of the injection. I'm going to give you some stem cell food recommendations that will stimulate not only the injected stem cells to grow, but yours to grow. There's a certain way of eating, and it's not bird food, and it's not horrible. Anybody can do it. You can do it. You get 5 PEMF sessions. Those are $250 value. In 6 weeks, there's going to be a follow-up. You can come into my office. I have people that come from very far away. We can get on the phone and talk, and then re-x-ray in 3 months. So you get a $700 bonus value by using our office, and you get all these extra things, no charge. So why do you want to feel better? So in the beginning, I showed you the picture of my grandkids. Look, I love dancing with my wife. I love walking Knott's Berry Farm and SeaWorld. I'm so excited to go out and surf again and lift weights and have a great time doing those things. But I tell you, man, it's those grandkids, that silly little giggle that comes out of them as we're playing around and wrestling and having a good time. And, you know, when they look me in the eye and they say, I love you, Grandpa. I love you. I tear up. I'm a big guy. I've done a ton of sports in my life, and you know, I'm tough, you know. But man, there's something about those kids when they look at you and they got those big eyes and they tell right from their heart, they're telling you that you're it, you're great. And when I wasn't playing with them like that, I wasn't getting that. And it made me sad because I had that before. So I have it again now, and it's just a joy. It's just great. I'm so blessed. I'm so happy that I have the use of my arm back, and my wife's got her knee back. And now I don't even think about it. I don't even think about, wow, I have a shoulder, or my wife says, I don't even remember I have a knee, because I don't even have to think about it anymore. Wouldn't that be great to have that happen with you? So real quick, I said something about is with the stem cell. So we also do another thing called recuperative therapy, and it's corrective and therapeutic. Here, I got this off the thesaurus. And so what is it? It's microcurrent cell signaling. Now this has been around for 20 years, but in the last 2 years, they've been using this machine, this therapy, in conjunction with some vitamin injections that go right in where you're having the pain, and then using this machine really helps. And this machine is really great for all the joints. It's great for neuropathy. It's great for pain that you just can't seem to get rid of. And it's FDA approved to treat pain. FDA approved to treat pain. What does that mean? Medicare and other insurances have to pay for it. So now this is a process where you're going to have to come into the office, you know, 2-3 times a week, anywhere from 8 to 12 weeks, you're going to do that. So yeah, there's a lot more energy and effort that you have to put in. You may have a copay of $10, $15, $25 each time you come in. So there's that. But it does work, and it works well. Now, it's not stem cells. It doesn't replace, you know, everything, but it certainly helps you feel better, and it does do some recuperative powers to make that area work the way it's supposed to. So this is a study with 16 patients with neuropathies, and when they came in on day 1 of treatment, they had pain of rated from 0 to 10 at a 5. And as you can see, as they're doing the therapy, the pain was getting less and less and less. And then from day 14 to day 20, all zeros. Everybody was zeros, all 16 of them. Amazing. An amazing, amazing piece of equipment. So here is a testimonial here that I have on the, it's called Synexus. And it's a great piece of equipment. And so just sit back and listen to Irma here that with the her telling her story of her sciatica.
When I came here, I have a lot of problems, you know, and I was looking how to help myself. And I have spinal stenosis and sciatica. It was so terrible pain, couldn't sleep at night time, you know, I could walk at daytime, I cannot play tennis, I cannot do anything. It was, you know, one day I saw on TV, on a computer, you know, on Facebook, you know, somebody offering help, and I came. And I was surprised, and you know, especially this machine.
Yes. So real quick. So how long have you had the sciatica?
About 7 years. You know, I was suffering. You know, just steroids to my spine. You know, many times, and doesn't help. No. I feel even worse and worse and worse. Right. And you know, just, you know, it's so nice now. You know, I feel much better. Yeah. Maybe like a 20% left. Pain, you know, it's so nice, so good.
So you're sleeping?
Yeah, I'm sleeping better, of course, because no pain, you know. I am so nice, you know.
And you're going to try and get back to some activities?
Back to play ping pong, back to gym, and little by little.
Fantastic, very good.
Yeah, I'm so happy.
Good, me too.
The results, I'm happy.
Good. And,
Yeah.
and so, Rima, if somebody was skeptical about coming to see us to see if we could help
Yeah,
them,
I was
what would
skeptical.
you say?
I
Well,
was
of course.
skeptical.
Yeah,
I
you
will
would.
tell all my friends suffering from this, just come and try, and you will be happy. You will be really happy, like I am now.
Fantastic.
So
Great.
nice.
Okay. Thank you, Rima. I appreciate your help.
Yeah, thank you to you.
So, again, amazing. So finally, insurance for natural treatments. You can do this. And so these therapies are covered through Medicare and other insurance companies, and you're responsible only for the copay. Now, I want to be really clear. Don't come into my office and tell me that I said stem cells are covered by your insurance, because read along with me. Stem cells are not covered. Good. Okay, all done. So let's move on. So your simple next steps. So if you're watching this and you've already been to my office, you've already done all these things. Just hang in there, I'll be done in just a minute. On the other hand, if you're watching this and you haven't come to my office, then this is how we operate, and this is what we do. Reserve your spot. Get your customized regenerative recuperative consultation. So how does that all work? Well, first of all, we want you to bring the person closest to you. Very important. Not only will that person be another set of eyes and ears about what I have to say, I get information from that person that sometimes you're not going to tell me. Just a few months ago, I had started to think about, maybe I shouldn't be, so tight about this, wanting people to, bring in a spouse and so forth. But what happened is that I go through this whole thing with this guy. He's looking to get injections in his hip and his back, and I said, is there anything else that I need to know about you? And he says, no. And then his wife says, well, I have a question. I said to her, anything that you'd like to add? And she goes, well, I have a question. If he has active cancer, is this a good idea to do this now? And I'm looking through the paperwork, and right there in our paperwork, it says, have you ever had or do you have cancer? And he put no. And I said, well, who has cancer? And she goes, well, he does. And I look at him, and he kind of looks at the floor. And I said, what is going on here? He goes, well, I knew that I went to the talk and you said we wouldn't, if I had active cancer, I couldn't get the treatment, but I really want the treatment. And I said, oh my God, that's insane. Without her being there, I never would have known this. I would have given this to him. Now, look, it's not going to go to the cancer and create more cancer cells, all right? It doesn't work that way. But what it would do is it would go and affect the cancer and the inflammation around it, and his chemo or whatever treatment he's getting is not going to work as well. And I wouldn't want to be part of that. I wouldn't risk you to do that. So he's got active cancer, active treatment, and he lied to me, but without the wife. Now look, if you make all the decisions all your own and you can decide, to get the stem cells or get the Synexus treatment, and you don't have to talk to that person about time or money, and it's all that, great. But don't do this to me. Don't come to the office. I spend a half an hour with you, and then at the end of it, you go, I got to go home and talk to my spouse. Or I got to go home and talk to my significant other. Or I got to go home and talk to my kids. Don't do that. If you have to do that, they should come, because there's no way that you're going to be able to tell them and show them what I did. Okay? Please, I'm just trying to make this as best as possible for everybody. That's it. So the ultimate question is, are you ready for a change? We're not made of drugs. We're made of cells. Think about that. I love this picture. All right. The power to heal, the power to regenerate, the power to rejuvenate. It's the power of young cells. This is why we use the Wharton's jelly. It's safe, it's strong, it works. And I just am so blessed that I'm in a time and a place that allows for this to happen, for people to get safe, easy ways to get better. So I got right here, I got 6 testimonials in 60 seconds. Go ahead and watch that.
Come over. It's worth it. I mean, whatever it takes to get our health back and our quality of life back is worth it. It's
Good.
just worth it.
Well, I tell them to go and try this, because it will give them back their things, especially their physical fitness.
Definitely, I would definitely recommend following what you say. The protocol here, very healthy, feel so much better.
Beautiful. Great.
So
Thank you very much, Lloyd.
Thank you.
I'm not one that goes and touts things and tells people what to do. I was in a meeting this morning with 23 people, and I could not sing the praises of this and what you're doing high enough. It just is, it's changing my life for the better. It's important to me. I don't know any other way to put it.
So I am so thankful I came here, and I can't tell people enough how good this was for me.
I would tell them to don't hesitate to come here.
So to get your recuperative regenerative evaluation, you're reserving my time. So again, it's a consultation, exam, and x-rays, and written recommendations. So normally that half an hour is $150. If you schedule on your time, it's $95. I'll explain what that means in a second. If you schedule on my time, it's $49. So if you watch this video and within the week call and you come in, I'm going to do it for $49. If you wait after a week, it's $95. Why? Because when we got this information to you, we decided that we're going to hold the spot for you, because that's usually what happens. And if you, and it's in the coming week. So if you don't make that appointment, then it's just going to be $95. Now, any fees paid for that are applied to any plan if you do it, or are refunded after you attend the appointment. See, I'm not charging for the appointment. I'm charging you, I'm holding that spot for you, and the only way that you get charged is if you don't show up. If you don't show up and you've wasted a half an hour of my time, that's when we'll run that and I get to keep the money, all right? I don't want to waste your time. Please don't waste my time. Please, we're way too busy for that. And I love what I do. I love what I do. I like staying busy. It keeps me out of the staff's hair, and it all works really well. So again, why do you want to feel better? What is your big why? Why would you want to come in and get this taken care of? I want you to think about it, and I want you to get on the phone and make the call. There's information, if this is something that you've already been in the office, God love you, thank you for coming in, and hopefully we're going to get a chance to help you out. If this is something new for you, great, give us a call. There's no charge for that consultation or those x-rays. There's no high pressure. You say this isn't for you, you don't want to ever hear from us again, you'll never hear from us again, all right? All right. With all that, I'm Dr. John Harper from beautiful Oceanside, California.